This is Dr. J.Marten, plastic surgery specialist at Area 88. Today I'll be explaining the difference between men and women in facelift and why facelift is performed after malar reduction plasty. There are distinct anatomical differences between male and female face share many common features. In surgical planning, male and female facial aging process but attention must be paid to differences specific to men. This is a male patient. It's a photo of 5 weeks post-surgery. There still remained some swelling. Malar reduction plasty was done but sagging developed, so fat graft and thread lift was performed. Then after that, liposuction. You have to be very careful when liposuctioning the face. You can damage the retaining ligaments between the skin and subcutaneous layer while suctioning, and there are many cases where there's more sagging due to it. Here you need to take a good look at the philtrum. No philtrum reduction surgery was done here, but rather when the mid-cheek is lifted via facelift, it has the effect of slightly shortening the philtrum like it is now. In this individual's case, he wanted a little more volume around the cheekbones. Usually Korean patients want volume in the area in blue and rarely want part in red to be large, but if there's too much sagging or drooping after malar reduction surgery, there are cases where patients want volume in that area during their facelift, like this case. You can see more clearly from the side. This is the jawline, and mid-cheeks. There are still sunken areas here. If it's still insufficient after the swelling subsides, 1 to 2 cc of fat graft will be done. Some hospitals say there's no need for fat graft and facelift. That's not true. Most young patients don't need them, but in cases like this, or with patients in their 60s and 70s, adding fat grafts can give much better results. Dr. Martin came as a speaker at Korean Aesthetic Plastic Surgery in July 2021, and the topic was simultaneous facelift and fat graft. I've spoken on Dr. Martin many times before, so sayings like facelifts don't need fat grafts simply lack understanding of the aging process or facelift. Let's look at the bird's eye view. Actually, the width of cheekbones don't widen. It feels as if it's become slightly larger with the current swelling and smaller lower face. Also in this patient's case, I gave volume to the red area using the SMS. You can see the jawline and mid-cheeks have lifted. The topic of facelift for men has been discussed for a long time, and this is an article published in 2008 under a single theme. The content deals with distinct characteristics of aging when facelifting men, points to consider, why it's difficult to operate on the mid and lower face, the need for skin care in men, peeling, etc. In most cases, male facelifts are dealt with separately, and the most noted difference when explaining the difference from women is that male skin and blood vessels are thick, and bleeding due to this is mentioned the most. The vascular supply to the sebaceous glands is also involved. It's explained to some extent that scars in the sebaceous glands from acne tend to bleed more during a facelift in women due to large sweat glands. For most men usually, the epidermis, dermis, subcutaneous layer have thicker, firmer hair follicles characteristically distinct from women, but distinction should be made more so between individual differences rather than gender differences. This relates to scarring and requires appropriate surgery accordingly. Even in women, if these characteristics are present, you must pay attention to them in surgery and make adjustments. In the end, the area to pay more attention in surgery for individuals with male characteristics is bleeding and surgery aftercare. In the last video, I've explained the skin and subcutaneous tissue, that the two need to be distinguished from each other, and that facelift deals with the subcutaneous tissue. Although facelift does not pull the skin but rather the subcutaneous tissue, there are clear changes in the skin. Thus the structure of pores, scars, acne, epidermis, dermis, the study of skin structure, etc., research on the skin, it's all necessary. To solve the issue of sagging after facial contouring surgery, especially after malar reduction plasty, people get fat grafts, thread lifts, HIFU, etc., and in the end, facelift. There are various reasons, but after malar reduction plasty, there's some sagging just inevitable. What can somewhat prevent sagging of the face after malar reduction plasty is bicoronary incision, which is a full incision of the head, but it is true patients find such surgeries to be too much. I plan to discuss facial contour surgery and facial sagging in detail next time. Thank you.